For our EBP project, we formulated the research question: would hospitalized patients have a decreased incidence of CLABSI if the clinical staff utilized CLABSI bundle protocols as opposed to not using CLABSI bundle protocols during the duration of the hospital stay?
Central line-associated bloodstream infections pose a massive threat to millions of individuals across the United States each year. Although necessary for hemodynamic monitoring and administration of fluids, medications, and total parenteral nutrition, central venous catheters are not without tremendous risk. CLABSIs occur in approximately 250,000 individuals and result in approximately 33,000 deaths each year.
However, as considerably life-threatening as CLABSIs are, they're largely preventable. Through a collection of evidence-based interventions, the Institute of Healthcare Improvement created a central line bundle, or CLABSI bundle, which has been successful in significantly decreasing the incidence of CLABSIs per year.
The CLABSI bundle consists of 5 major components: hand hygiene, chlorhexidine skin prep, optimal catheter site selection, implementation of the checklist, and daily review of CVC necessities.
How is this relevant to nursing? Nurses often provide care for patients with central venous catheters. Therefore, they play a role in the incidence of prevention of CLABSIs. Through proper understanding and utilization of the CLABSI bundle, nurses have the potential to decrease the number of infections occurring each year, consequently saving the lives of numerous patients.
The purpose. The purpose of implementation of the CLABSI bundle would be to improve patient outcome and decrease medical cost. Catheter-related bloodstream infections increase a patient's average length of hospitalization by nearly 12 days and cost on average $18,432 per patient.
Is to evaluate the effectiveness of CLABSI bundle in reducing central line associated bloodstream infections. Our first study is a qualitative research study. It is titled Implementing the Central Venous Catheter Infections Prevention Bundle in the Emergency Department: Experiences Among Early Adopters.
The purpose of this study is to investigate the perceptions of ED staff to explore the barriers of central line bundle use and their motivation to adopt the bundle. Findings. The study established the idea that staff engagement, clear staff responsibilities, a checklist, and observer empowerment can all contribute to increased usage of the CLABSI bundle and decreased instances of central line associated bloodstream infections. Relevance. Being aware of what can interfere with the bundle adoption and the ED will allow for changes to be made for the improvement of the adoption and will help reduce incidence of CLABSIs. Feasibility. All study participants were nurses and physicians, therefore, the information provided was qualified healthcare providers. The study was also approved by the Institutional Review Board. All equipment was available through the facilities that participated. The sample was cooperative and large enough to represent the population. Benefits. The study determined factors to improve bundle adoption and implementation, therefore reducing the incidence of central line associated infections. Risks. No risks were involved in the collection of data. Investigators used semi-structured interviews to obtain information regarding the CLABSI bundle.
Our second study is a quantitative research study. It is titled One Rural Hospital Experience Implementing the Society for Healthcare Epidemiology of America Guidelines to Decrease Central Line Infections.
The purpose of the article is to review CLABSI rate after the implementation of the bundle. Findings. After implementation of the CLABSI bundle and analyzation of the monthly CLABSI rates over the 3-year period, a downward trend was exhibited across the 3 time periods. Therefore, the CLABSI bundle and SHEA protocols were successful in decreasing the incidence of central line associated bloodstream infections. Relevance. This article demonstrates the effectiveness of the bundle in reducing central line associated bloodstream infections.
Feasibility. The sample consisted of 76 patients and was representative of the population, and data was obtained through the CDC National Healthcare and Safety Network. Benefits. The study determined the effectiveness of the CLABSI bundle and listed the proper ways to care for the central line. This information has the potential to educate healthcare providers and decrease the number of central line associated bloodstream infections. Risk. Risks were minimal throughout the study. Descriptive statistics was the main method involved in the collection of the data. Study number 3 was also a quantitative research. The study was titled Use of Central Catheter Maintenance Bundle in Long-Term Acute Care Hospitals.
The purpose was to determine if implementation of a central catheter maintenance bundle would reduce rate of hospital-acquired CLABSIs in long-term acute care hospitals. Findings. The pool mean CLABSIs rate was 1.28 before the bundle was in place and was 0.96 6 months after the bundle was implemented, which is a 29% decrease. Relevance. The implementation of the bundle had an immediate effect on CLABSI rates. The implementation can reduce morbidity and healthcare costs.
Feasibility. All members of the central catheter teams participated in training throughout the study. The researchers and members were qualified to conduct the study. Benefits. Compliance of the bundle was measured throughout the study, and education was provided to members to allow for a decrease of CLABSI rate. Limitations. Certain patients had central catheters inserted prior to admission to the LTACH. The risk of developing a CLABSI before admission could have affected the results.
Study 4. Facilitating Central Line Associated Bloodstream Infection Prevention, a qualitative study comparing perspectives of infection control professionals and frontline staff.
The purpose of the study was to determine if ICPs and frontline staff had different perspectives about the facilitators and challenges of central line associated bloodstream infection prevention program success. Findings. The results of this study suggest that detailed education in regard to the implementation of CLABSI bundles is critical to successful prevention. Relevance. Proper education and implementation of the CLABSI bundle must be present in order to decrease incidence of central line associated infections.
Feasibility. The sample focused on the comments of 76 individuals out of 194 who played a direct role in utilizing the CLABSI bundle. This provided a sample that was qualified as well as representative. The data obtained was thoroughly analyzed through inductive and deductive methods, providing accurate and relevant information. The results of the study emphasize the importance of education in regard to the implementation of CLABSI bundles. This can ensure future effectiveness of implementation. No risks were present throughout this study. Data was obtained through a non-invasive interview approach.
Design. The definition of proposed changed. To decrease central line associated infection through proper implementation of the CLABSI bundle.
Implementation process in a hospital and setting include developing workflow of the bundle care, staff training, and follow-up.
The needed resources: CLABSI protocol training, hand hygiene, barrier precautions, chlorhexidine skin antiseptic, and sterile dressings.
Developing workflow of bundle care. Design a standard CLABSI bundle care protocol to initiate hospital-wide. Develop a checklist that is present throughout the facility to be signed off after the completion of each component of care. Have resources readily available.
Staff training. Staff-specific training will be initiated. Staff training will be provided for all members involved in care of central lines. Testing on the components of the bundle to ensure competency, and continuous training to reinforce the concepts of bundled care. Follow-up. Random weekly evaluations throughout the facility to make sure checklists are being completed and that there is consistency with adherence of the bundle. Feedback from staff regarding bundle compliance, i.e., barriers or complications, etc.
Outcomes. We will evaluate the process by observing the bundle being utilized and by measuring the number of infections that occur through the use of laboratory findings. We can determine that the bundle is effective if the number of CLABSIs decrease.
Integrate and maintain. We will decide to adopt the CLABSI bundle protocol if the number of central line associated infections decrease after utilization of the bundle.
Integrate and maintain. After adopting the protocol, we will update hospital policies and provide mandatory training. The changes will be communicated through staff meetings and monthly audits will determine accuracy and proof of utilization by healthcare providers. The effectiveness will be reported to stakeholders through a document displaying analyzed data.